you ask us to sort of look inside, like how do we get here, right? And I think there's a lot of reasons, and I think we need to sort of begin with a validation that lack of trust is a creation of our own making. If our, as a healthcare provider, as a physician like Richard, but as someone who's also worked in government and with government, trust is really essential. I mean, I think the first point is that it's spot on to talk about trust. I mean, something I learned someone said to me several years ago, which I really like, is progress moves at the speed of trust, right? Without trust, progress isn't going to happen. And AMP Health, again, what we do is that we work with governments to help them build leadership and management capacity of the public sector. And actually, the foundation of our theory of change is trust. I mean, very interesting. That's why I was so interested when I got this invitation to participate, because it's such a part of my day-to-day. And we embed mid-career professionals from Africa in these government teams. And we're very clear on the brief. These are mid-career professionals that've got a lot of experience. And we ask them just for the first 3 months to listen. And I think that one of the things that we really need to remember if we're going to rebuild trust, we have to relearn how to listen. And we have to listen genuinely, not listen as a tick box, we've heard you and we move on. But if we're going to listen, and that starts within teams, it starts at government, but to take it further, this is about listening to communities, listening to people, and everything from the research agenda to the implementation of healthcare programs. We need to involve people at every level, from national to community, and we need to listen to them, and they need to be part of it. And I look forward to, as the conversation continues, picking up on some of the other themes that emerged today, but want to make sure there's time for others.